What a day. We're so excited. So excited to be here. Again, I'm Rick Shumway. For those of you who I haven't met, I'm the president and CEO here at Stanford Healthcare Tri-Valley, as well as what we call Stanford Medicine Partners, which is our medical foundation. It's really a pretty amazing day, actually, to think about this. And topically, this very specific thing that we're going to talk about today, AI, makes all sorts of sense to take place right here in Dublin, California, with this very specific group of people. As I look around the room and as I think about who is actually here, it's really an amazing cross-section of our community and of our region. We've obviously got our really amazing government partners. We're so grateful for those partnerships. We've got tech leadership here for organizations that have come to the Tri-Valley and have established themselves here to push these boundaries and to actually move this part of the industry forward. We have community leaders. We have supporters of the healthcare industry. This is really an appropriate group to have this conversation with today. I'm so grateful that all of you would take time out of your busy schedules to spend time with us this morning. It's really exciting. So it's interesting as I think about the concept of what Stanford is. And that's a hard question to answer in many respects. But one of the things that I have come to appreciate over the about 5 years that I've been here, part of Stanford Healthcare, is that at Stanford, it is all about pushing what is next. We are always looking forward. We are always looking towards the next thing. And it's interesting as I think about what our mission is. Let's see if I can quote this correctly. I hope I can quote my own mission correctly. It is healing humanity through science and compassion, one patient at a time. That's a pretty ambitious mission. I will say that if there's an organization that can do that, it is Stanford Medicine. And today is really a reflection. You'll get to hear from some of the leaders that are embodying that very specific mission, that we are here to heal humanity through science and compassion, one patient at a time. And through world-leading, groundbreaking technology and innovation, we're able to see some of those things come to fruition as we speak. And so you'll get to hear a little bit about that today. So at the risk of sounding like the least intelligent person that will be on this stage today, which actually is true, that's a true statement, let me give you a little bit of a sneak peek of what we're going to talk about today. It's really pretty exciting. So when you think about the applications of what artificial intelligence can do in the healthcare delivery system, it can be a lot of things, and you'll hear a lot about those. So one of the things that we're obviously focused on is improving patient care. We want to improve physician and provider productivity and efficiency. We want to make sure that we understand complex biological situations that are going on in the human body to be able to intervene earlier. And one of the really exciting things that's happening that you'll hear about is a lot of the work that AI is doing at Stanford in the world of drug discovery and treatments and clinical protocols that are informed by this amazing technology. It's amazing to think about the people that participate in this. Many of them will be here with you today and be able to speak. I've said it a couple of times. They won't like me to say this, but I'll say it anyway. It's interesting being at Stanford and being around the kinds of people that we get to be around every single day. The people that you're going to hear from today and those that are working in this field at Stanford are literally world-class leaders in the fields of biomedical, bioinformatics, all of those things that are changing the way that we think about this. What I love about this environment at Stanford is that not only do we have these amazing world-class leaders and experts, they're working incredibly closely with other industry leaders, other partners, whether that is here in the Tri-Valley and its innovation ecosystem, or Silicon Valley, or anywhere else that we can find really amazing, thoughtful, innovative partners. So I'm really excited about that. When you think practically about what is happening in AI at Stanford Medicine right now, a couple of things I'll share with you. So number one is we actually have more than 30 applications that are running right now at Stanford Medicine that really leverage this AI technology. That's probably an understatement, right, Mike? There's probably more than 30. But there are some really exciting things, couple that come to mind that I think are literally changing the way that we take care of people and the way that we advance medicine. So one is called our Dragon Ambient Experience. So if you've been to the doctor recently or at any point in your life, you will recognize the infrastructure that happens when you sit in that clinic room and you talk to your doctor. What's your doctor doing? Your doctor's having some conversations with you, but what's the other half of what they're doing? They're on a computer, right? They're going back and forth, they're talking to you, they're documenting back and forth, so on and so forth. So simultaneously, those physicians have to make clinical decisions while they're documenting important clinical information that is going to ultimately inform the care then and down the road. It's actually a pretty challenging environment to practice medicine in. So this new AI technology, you take your phone out, I won't because I'll mess my mic up. You set it on the table, you turn it on, and then you talk to your patient. The AI listens to that conversation, synthesizes what's being said, transcribes it, and puts it into the clinical documentation construct that's necessary so that you can actually focus on that conversation that's necessary with your patient. And then you go back and you check and you make sure it did what it was supposed to do, and you move on and you're able to move forward. That's an example. Another example, this is really amazing, is when you think about how we are integrating augmented reality into surgical practice. So we actually very recently in Palo Alto had one of our Stanford cardiologists, Dr. Alexander Perino, who used has anybody used Apple Vision Pro? Has anybody done a cardiac ablation with that? So Dr. Perino did. And that's really one example of the ways that we're actually integrating it, not only into the clinic experience, but into the cath labs and into the ORs and into all of the areas that we actually operate in every single day. I mentioned drug discovery. It's really unbelievable to think about that. When you think about what it takes to bring a drug to market, it is literally years and mountains of data and effort and coalescing of all of those things. Working on things that will allow us to synthesize that in a much more seamless and facile and quick way is one thing, but in a much deeper way than we're even able to do with the tools that we have right now that are informing and speeding up the development of critical therapies that our patients are in significant need of. Last thing that we'll talk about, or I'll talk about for just a second, is the thought of feeding medical images into these deep neural networks that take your X-ray or take your MRI and actually do deep assessment and analysis with a machine learning capacity and identify things that maybe one of our exceptionally talented radiologists might not see. And so that radiologist, in partnership and utilizing that technology, can make a better, more accurate, focused clinical decision. So the applications are literally exponential. And I'm so excited for you to be able to hear today more in depth about how we think about these things, how they look, how they feel, and what we anticipate will be moving forward as we go. Melissa mentioned just a second ago that errors in this arena are life and death at times. And so we've taken that exceptionally seriously, and you'll hear a little bit about that as we go today. But here at Stanford, we have actually established what we call RAISE Health. So I will make sure that I don't get this acronym wrong. Responsible AI for Safe and Equitable Health is the organization that we've established to ensure that the appropriate guardrails and protocols and algorithms are in place, that we're using this, A, the way that we should, B, in a way that's responsible, and C, in a way that's equitable. We want to make sure that it's good for everybody that has the opportunity to access that. So I'm really excited. I'm really excited about this as an arena that we get to play in on a regular basis. I'm so honored and so grateful to be a member of Stanford Healthcare, who is literally pushing this frontier, not only as a boundary, but has crossed that Rubicon and is developing the things that you read about on the news and that you're experiencing every single day. And so I'm really honored to be able to introduce literally a world leader in this, Dr. Nigam Shah, who will get us kicked off for the rest of our program. Thank you.